Hello, everybody. Today I'm with Dr. Tina Wong, which is a glaucoma specialist for more than 20 years. She's a clinician researcher. She's a businesswoman. She's so many things. She's a leader in the ophthalmology world. And I will let her to introduce herself more for the people who don't know her.
Oh, thank you very much, Dr. Doha. And it's a pleasure to be here today, be participating in this podcast. I'm Professor Tina Wong, and I originally trained at Moorfields Eye Hospital, and I did a PhD there. So I'm very passionate about research. So I am a clinician scientist. And on top of that, I was the previous head of the glaucoma service at the National Eye Center in Singapore. And I have 2 startup companies with 2 other ones about to emerge. And I also was responsible for the innovation landscape in terms of disbursement of grants for the whole of Singapore's inventors who want to develop new technologies for healthcare.
Mashallah, as we say. I fought for this interview, actually. I wanted to interview that great woman. She's very inspiring. And I wanted to know who is the woman behind the businesswoman and the leader that she is and the woman advocate that she is. So can you start, Dr. Wong, by telling us why did you choose ophthalmology and why did you choose the glaucoma field, which is a field, if you do not really love it, you cannot just choose it like this?
Well, I chose ophthalmology really because when I was a resident and when I was a house officer, I really wanted to do something that was surgical. Because through all the rotations, I realized that if you do surgery, you can see the outcomes almost immediately. I'm a little bit impatient. So I like to see outcomes and I like to see patients very satisfied afterwards. But unfortunately, there's a small thing about me is that I don't really like blood. Not because I'm squeamish, it's just that I realized that a lot of surgeries, when things get a bit bloody, you can't see what you're doing. So I felt that, ophthalmology is a lot cleaner and, the organ is very accessible. You don't have to dig yourself in to find the right part before you start doing your surgery. So that's really where I sort of felt I needed to understand a little bit more about ophthalmology because in the UK, and I'm sure in your country as well, when you're a medical student, you only have 2 weeks exposure in ophthalmology. That's really nothing. So I really went out of my way to sort of understand what the subspecialty was like, and I really got hooked. And how I got into glaucoma, in fact, when I was a resident in ophthalmology, the strange thing is that I originally wanted to be a corneal specialist.
I see you more because when you're in patients, you do refractive.
You're absolutely right. So,
and I am an impatient. That's why I want to see immediate.
Exactly. So, I really enjoyed doing cataract surgery. When I trained, we started with ECCIs and then we went to phacoemulsification, and that's how I got into phaco through my training. But, when through my training, I then decided I wanted to do a PhD halfway through before I became a consultant. So I went to the Institute of Ophthalmology at Moorfields, and I spoke to Professor Sir Peng Kaur, who is a renowned glaucoma specialist in the UK, very well known, and has made many sort of landmark changes in how we can improve surgical outcomes in glaucoma surgery. So I went to him and I said, look, I want to do a PhD. And then he said, yes, I've got a project, but it's in glaucoma. And I said to him, no disrespect, I'd like to specialize in cornea eventually. And so he looked at me. He says, well, Tina, you can still go back into cornea after you've done your PhD, because doing a PhD, it's supposed to give you tools to be a researcher, a scientist, to think with hypothesis-driven sort of way. So it doesn't really matter if you have your project is in glaucoma wound healing. You can always go into cornea afterwards. Obviously, I didn't. I went back,
30 years later, she did not.
So he had that wisdom. He knew at that point he'd got me.
He saw the glaucoma
He
specialist
sold it to me
you.
innocently. So I just believed him, and I thought, I'm going to be a corneal specialist. 4 years later, I did a glaucoma fellowship.
Okay.
And the rest is history.
Yes. Why wound healing?
Well, I think wound healing is, as a surgeon, one of the major reasons our surgery fails is due to scarring. So scarring is not just about in the eye, but any part of the body, you have loss of function, okay? And for us, even for corneal refractive surgery, if you have inflammation and scarring, you have drop in vision,
Yeah.
you have visual morbidity. Retina surgery, you have scarring, you have PVR. Then, you have failure of surgery. And glaucoma, obviously, if you have scarring, your pressure goes back up again.
Yes.
So it's really the final frontier of having the perfect operation. And I like a challenge.
Yes.
So that's why I went into researching into antifibrotics and how to improve surgical outcomes.
I want to know actually, as a specialist in glaucoma, I am one of those believers that glaucoma is such a complex pathology where I know I might be sometimes criticized for thinking this, but I think that when you give a patient all the drops he needs to lower his pressure, and the pressure is still up, I think actually, I personally think, and this is not medically proven, this is not scientifically proven, that there is so much more to it. Do you believe that there is other than what is anatomical and functional, and there is energetically and sometimes it's emotionally blockages, or sometimes some things that we do not deal with that repercolate, or actually that for example, a patient who has a glaucoma makes him not responsive to a treatment. And there is a psychological part and there is something else. Are you one of those believers, or you just like, no, it's anatomical, it's canal de Schlem, it's the trabeculum, that is only how I see it?
No, it's more complicated than that. And you're right, absolutely right. We are beginning to understand that there is a concept, well, it's not an unknown concept, it's been going on for a long time, pharmacogenetics. So you can give somebody a pill for their blood pressure, they don't respond so well. You give them a different pill, they respond much better. Because we are inherently, made up of various sort of genetic, diversity in that sense. And so one person can respond very well to one eye drop, and yet the other one is a non-responder, right? We get that all the time. Or the effect may eventually wear off, such as like beta blockers, okay, which is what we normally see. Yeah. So I believe that it's not just about giving the patient the eye drop. There's a lot more research that needs to be done to identify which type of people would benefit what type of classes of drugs to get the best optimal outcome from those eye drops. So prostaglandins, we understand that there are some patients that are prostaglandin non-responders, about 20% of them, they don't respond. Even with mitomycin C treatment, we understand also that there are certain individuals where mitomycin C just doesn't touch them. And their cells are resistant to the treatment of mitomycin C. How we are able to understand that and to project and have sort of like a precision medicine approach to surgery or management is still in the works. But I believe, all humans are complicated, and we're not all born the same. And regional differences in individuals can also play a huge role, which is very, very underappreciated and underestimated. So, I could lecture about this for a long time, but I think this is something that we as clinicians need to at least... We don't talk about it, but we have to appreciate it, that if a patient comes back and they clearly are compliant, but the drops are not working, then we have to accept that, well, they're non-compliant, or they are compliant, but they are non-responsive because of other factors. So we have to then make the decision to change their management accordingly.
But also changing the management, but also I think must be an education on the patient to seek for his health, for example, meditation and yoga and stuff like this. I really truly believe that once the patient actually sees and cares for his mental health and his luggage of emotions and stuff like this, things actually go in a good way. I truly believe that. I know that it's not scientifically proven, I know this, but it's something, for example, that I say to my patient, I'll tell them, take care of yourself, do something that makes you happy, because it's gonna impact on the way your body is reacting in actually accepting the medication. I don't know. You're the specialist, so I want to know what's your opinion on that.
I think, well, there's a very well reported fact that patients, when they are diagnosed with glaucoma, they become depressed.
Of course, yeah.
It's a stigma.
And that's why some
society.
ophthalmologists don't want to do glaucoma and deal with it, because they're like, oh, it's the patients that are never happy. It's very painful to see this, and it's not easy to be a glaucoma. I say it, it's not easy.
Well, I think everything is relative. I think vitreoretinal surgeons have it maybe even harder. But what I'm trying to say is that we have to be aware that sometimes it takes a little bit of time and a lot of tender loving care and counseling and support from our nurse counselors, also from their family members, to really be educated about the disease. Of course, they are scared of going blind, but what I try to do in my clinic is I empower the patients and make them realize that, don't let glaucoma take control of your life. You can be in charge of it, and you can, sort of channel the way the disease progresses. It may never progress if we work together as a doctor-patient relationship, and we manage critical points where it could mean that it is progressing. And, we just have to be hopeful in that sense, and not to sort of fall into the dark pit of depression. And a lot of patients, are often poorly educated about what glaucoma means. They think they're just going to go blind, and that's why they go into denial, and they don't want to use their eye drops. And it does take some time to get patients to come around the idea, and it's a lot of counseling.
And talking about patient education, I think it's really important, because glaucoma is still a dark spot for so many patients that do not know what there is. They never heard about it. They know what a cataract is. They know what a cornea is. But glaucoma is really not that understood, actually, and easily, and especially in many countries, even in big countries like Singapore.
Yes.
So we were talking about my early speech about how social media actually impacts on education. Do you agree with the benefits of it?
Yes, absolutely. I'm 100%. And you didn't pay me to say that. I totally agree. Because glaucoma, unlike, I would say, any corneal condition, refractive condition, they are asymptomatic most of the time until it's end stage. And so if I tell you that you have something that you're going to go blind, but you are perfectly okay. So, well, I can see fine, doctor. What are you trying to do? Are you trying to just take money off me?
Take money.
And, what is this? Is this a scam? So it does take a lot of education to really get them to understand.
And I'm actually an advocate that social media can be used as a tool. When you have videos that can be seen millions of times, for me, it is better than seeing an ad on television, because let's face it, everyone is on their phone. And it is the easiest way to get those patients that I always say have access to their phones over an ophthalmologist nearby. So for me, it should be, for example, as you are someone who has dedicated their life on glaucoma, you should have a presence on social media, actually, and we want to see the woman that is behind it. And I think not only for the glaucoma part, but also because you may inspire many, many women. And I want to let you talk about what you did to women in Singapore.
Well, I would say I've always been very protective of female doctors. I mean, maybe it just comes from, when I was training as an ophthalmologist, I didn't really encounter any prejudice, even though I trained in the UK. But what I found was when I moved to Singapore, there was a different culture. In the West, it's a little bit more open, more liberal, a little bit more equal opportunities, so to speak. In Asia, there is a lot of the dominance and respect of the seniors. I think it's a lot even in the Middle East.
Even in Morocco,
right.
Even in the
Middle East and Asia, there's that culture of respecting your elders, et cetera, et cetera. So, you know, when I became the head of glaucoma service, I then started to realize there was always this undercurrent where even when some of the junior residents or the doctors, for example, they had to sort of share the good news that, you know, they were about to have a baby, they needed to take some time out, they were pushed back to say that, oh, well, then, you know, your promotion is going to be delayed and you have to repeat the whole year, and et cetera, et cetera.
So we have the same thing.
Yeah. So, and that is despite them going in and working there part-time or taking their maternity leave, but going back and, you know, and the hospital itself only had one lactation room for the whole of the eye center, which was shared by the nurses as well. So this is something that really disturbed me. Where you think that in ophthalmology is a very popular subspecialty for female doctors to go to, at least 50%, if not more now, are women that go into ophthalmology. And yet the support for these women in order to progress in their career and to juggle their own personal home life is limited at the workspace. It just really hampers their ability to progress and have a fulfilling professional development. Because I feel that a lot of women, they go in and they
hold themselves.
The problem is that women do have other responsibilities or duties outside of just being a doctor.
Yeah.
Whereas I say to my male colleagues, oh, you just have to worry about being a doctor. Your wife, who's a GP, has to look after you, the family, and do the full-time job and the kids.
Exactly.
So there's a lot going on with women. And I think after a while, we were able to sort of really make changes in the hospital to sort of accept it. And there was a culture change within the whole of the healthcare anyway, so it was really good timing. So, you know, improving the conditions for the doctors to work, having their recognition of, even if they were part-time, if they were working full capacity during their part-time, they were still recognized for their hard work. And also to be able to take time off, but also prorata their promotion period rather than just turn back the clock to zero again, back to baseline.
I actually had a conversation with a colleague of mine in Morocco and on the phone. I will never forget it. And she told me, Doha, we as girls, we are the first in school. We are the first in the faculty. But once we go into the working field, men shine over us. Do you know why? Because we have that imposter syndrome that is killing us. We always feel sometimes that, am I doing it right? Am I doing it wrong?
Actually, Doha, you're spot on. I think the main difference between men and women, and I know there's a man over there, men are willing to take risks.
Exactly.
Right? Girls think about all the possibilities, pros and cons, and actually, should I not? I'm going to call my girlfriend up. I'm really not sure about this.
Yes.
I don't think I'm good enough.
I'm the most indecisive.
Whereas the guys will just say, what the hell? I'll just give it a go. Okay. If I don't get it, well, who cares? I'll just try anyway.
Exactly.
It's this male culture that they just don't mind if they fail or if they look silly, or they'll just have a go. Whereas girls don't just have a go. They want to make sure everything is going to be perfect and that they've got the best chance. Then they will put their name into it.
Exactly.
So this is universal.
Yes. It's crazy because it's worldwide, because it is in Morocco, but it is in France. I saw it when I was there. It is in Middle East. It is in Singapore. It
Asia,
is
everywhere.
It's everywhere. It's everywhere. And sometimes you have a brilliant mind of an ophthalmologist. And that is why there was a study actually made that is much more safer to be operated. I don't know if you saw that study.
Yes, I did.
It's much more. I was so proud. I shared it. Like, Lear, this is your proof. It's much safer to be operated by a female than by a male, because And sometimes even the patients feel more confident going to a male, even if the female is actually, it's going to be like, yes, but they can be complicated. The male is going to be like, don't worry, everything is fine. We're going to, and even if she is more competent, but I think there's this imposter syndrome that we feel.
Yeah, I think we put it on ourselves.
Yeah.
We do put it on ourselves. But I think it's also because inherently, and it's in our biology, that we fuss over things because we are supposed to be the mothers.
Multitasking.
We multitask and we worry about our children. We worry about everything, and it comes from, from our mothers.
Yeah,
How you see your mother look after you and everything, and then you take that on and you think, okay, I have this big responsibility. I have to do a good job because, a lot hangs on it. So I can't be flippant or, I've got to make sure that it's absolutely okay and I'm ready to do it. Then I will put my name forward.
Yes.
But what I have noticed now is that when I was the head of the glaucoma service, what I would do is I would meet, half of the faculty are females and about 3 or 4 of them are part-time, young mums. And I would empower them. And I said, don't you worry. I've got your back. You go for this or you do not go for this. If you don't want it, I'll support you.
They're very lucky, but sorry to interrupt you. They're very lucky. You know why? Because sometimes as a woman in the field, and I am someone who lived that, I did not have chiefs who were actually who were women, but they were not that actually empowering other women. On the contrary, it was women tearing apart women, and we see that a lot in many fields, especially in ophthalmology. She doesn't want a woman to be better or to shine. And I felt it when I was used to do social media as an intern. I used to hide it a little bit.
Oh dear!
Because I could not just show it. Who do you think you are? What are you doing? You're just an intern, stuff like this.
Yeah.
But if it was a male, and there was a male, it's no problem with him. It's okay. And I'm telling this, really, they are lucky to find someone who empowers them, because it's not everywhere the same. When you see a chief and she's like a woman and you're like, okay, she's gonna be more understanding, and she is not, it's deceiving more than when it is a man. It's a man.
Yes, I think there are some undertones like this. The sisterhood doesn't seem to work quite well in the professional space. And I feel that I'm trying to work this out. I'm not like that at all. And I think that's why everyone for me, I'm like someone that people look up to, because they always say, they admire me. They know that I will mentor them and I will support them. I'll go out my way. I will stick my neck out and protect them. I'm very protective. For the boys as well, but the boys are, okay.
They don't need
but
protection.
They don't need that much protection anyway. But, but the girls, they do, because they're so fearful. And I have to speak up and rebut a lot of maybe some prejudices and things like that. I'm very vocal. And when people start to sort of like criticize my faculty, my girls, female doctors,
the lion comes out.
I will be
tear
out
them
there.
apart.
So it's the Asian tiger mum coming out. I think that's what I am.
Kung Fu Panda.
I'm a tiger mum when it comes to looking after the female ophthalmologists. And in Singapore, we have the Society of Ophthalmology, Singapore Society of Ophthalmology. They've just created a women's chapter, and they've asked me to be their advisor and mentor. So they come to me, and I'm fully 200% supportive of this. And we have a new community for the whole of Asia for young female ophthalmologists to join this chapter, so that we can empower. Yeah,
it's amazing. And I have one beautiful thought to a beautiful lady that is called Katia Al-Bulgalem, and she did the same thing in France. She's actually a refractive surgeon for more than 20 years, and she created the Society of Women in Ophthalmology in France. And it's empowering women in ophthalmology. They held the Congress every 1 to 2 years, and I think it's beautiful. And it was just recent in countries like France, where they have the same problem. Let me tell you, I was there. They have the same problem. They see women as... And I remember one time I had a conversation with her. She was like, I was in the field, but sometimes I was talking and they didn't even look at me. You can be grandiose in the field of ophthalmology, but when you're a woman, it's a second...
second class
a little bit. And I salute her for doing this, actually, and I salute every woman that is empowering other women, because we need that, actually.
Do you have this in the Middle East? in Morocco or anything like that? You have a women's sort of group? I think that should be your next task.
I think it should be the Middle East and North Africa. Yeah. I think so.
I think because Australia has one, because I went to the Ransco, which is their college meeting, and they have a very strong female group. And obviously in Australia, the men are very dominant as well. And I feel that they're fighting a lot. So I've been there and I sense it. But there's a lot of women who are very strong there who are pushing back. Yeah.
Every society is even in Morocco. It's 99% of the bureau who's male. You find one woman. And even in France, even in many countries, it's not specific to a region, but sometimes you can feel it in a region more than another. And I think it should start by women from all over the world saying, we should be out there. And that is why I actually think that someone like you, as a beginner, I'm a beginner in this world of ophthalmology, and I feel like I aspire so many young girls because of the charity work that I've been doing for more than 10 years and stuff like this. And I think that women like you should also be on social media because it helps other women say, oh, look, she did it. Oh, look, she's talking about, oh, look, she inspires me. Because you see posts about it, you feel like you see some figures that actually motivate you to give the best out of it. And I think it's amazing. And I think what is most important too is the support of the family. I don't know if you had that while being the independent lioness that you are.
I have. The reason why I can do all these things and have so many balls juggling in the air is because of my husband. Okay. I have a very...
it's always the husband.
He's very supportive, very. He's very proud of me. And he's my champion, #1 fan. In fact, maybe I should get him to start my social media. He's not a doctor.
Of course, when he is a doctor, that's why.
That's why he's not a doctor. So that's why, and my whole life, I knew him when I was a medical student, and we've been together for nearly 30 years. That's just telling my age. And he's still, very adoring, and he sort of like celebrates every single one of my milestones. And I feel that he's my cheerleader. He's my compass. He's the one that makes me motivate myself to do more and allows me to really push the boundaries and not be afraid. Exactly. Because if I have him, I know I can do anything. And that's what I want all the women to have.
And I love that you said that. You know what? Because so many men think, oh, those independent women, they pretend they don't need a man. We're not saying this. On the contrary, we need a partner by our side. And I think that women shine more where they have the right partner by themselves. And I think that you're lucky enough to find someone who pushed you through and made you actually expand. And that is not a view of, no, we're a woman, we don't need anybody but ourselves. On the contrary, I think a part of our biological and part as women is that we need that partner to be understanding, to be there. And I think it's beautifully said by you. And I really thank you for being such an amazing woman. And I had a blast interviewing you. And I think if they did not stop me, I would go on and on and on because we could talk about so many things. And I have a feeling this is not the first of our meeting. I feel like we're going to...
I hope we should definitely continue.
Yes,
next chapter.
Next chapter. See you next chapter. And you're most welcome in the UAE, of course, you know that. And in Morocco, we wait for you. There are some inspiring women out there.
It would be my absolute pleasure and delight to meet all the clever girls out there.
Of course. So thank you very much, Professor Tina Wong, for an amazing talk.
Thank you so much.
Thank you.
Bye.